Somewhere inside Kenya's border county of Migori, this seemingly insignificant road could pass for any other in a typical Kenyan village. But far from it, this road goes all the way to Tanzania, no questions asked. 300 meters away is the official Isebania border point, manned by these security officers. But this is where their work seemingly ends.
These people, they are crossing and they meet our police officers. Now, they give them some money as a bribe. Why should you risk? Why should you take 100 shillings or 50 shillings to risk the lives of 100 or 1,000 people?
At Eneo Mingi, still in Migori County, these two people on their way to Tanzania have to pay their dues to the police officer here before they continue with their journey. Even high-ranking officials appear helpless.
That is the greatest challenge. We decide on something which is good for the people, but most of them just decide to disobey those directives.
The so-called Panya routes have been bad enough in terms of distorting border patrols and aiding other illegal activities. But the advent of COVID-19 has put them on the spotlight again as new cases pop up in the county, thanks to these undocumented crossings.
There are borders that are known, Panya routes are known, and what the government is doing is to beef up security levels so that some of those Panya routes can be closed off. It's impossible for government to be able to monitor every mile of every border.
Indeed, the Kenya-Tanzania border stretches to approximately 769 kilometers. Its illegal routes putting in danger the lives of those in Migori, Kajiado and Taita Taveta counties. At the Namanga border in Kajiado County, business as usual, and the story is the same.
Wengine wanakuja kwa lori, wanakuja pandi. Sungeni sana watu wa kutoka sehemu zingine, maana hiyo ndio hatari tuko nayo hapa Namanga.
The World Health Organization had raised concern over how Tanzania handled the corona pandemic, even as its neighbors put in restrictions. A situation that has seen a rise in the number of cases reported in the country. Similar concerns also being raised about Kenya's frontier with Somalia, which has so far registered more than 1,000 COVID-19 cases. In Wajir, for instance, where the 9 cases were recorded, the patients had just travelled back to the country from Somalia through the Diff market. The Wajir County government now says it's moving to contain the situation. A statement to newsrooms by Governor Mohamed Abdi stated that they had closed the Diff and Dagalay markets to prevent the spread of the virus into the country.
Our appeal to the public is that you should also become the public police in case you realize that somebody has come in who has been away, to be able to liaise with the security and health teams to inform them.
Health officials are now high alert as cases soar in some of Kenya's neighbors, and with long and porous borders almost all around, containing the virus that respects no borders will continue to be a big challenge. Raquel Muigai, Citizen TV.